হ্যালো বন্ধুরা, JEPBN 2022 পার্ট বি এর 30 কোয়েশ্চেন আগের ভিডিওতে ডিসকাস করেছি। আজ পার্ট বি এর নেক্সট 30 কোয়েশ্চেন অ্যান্ড অ্যান্সার ডিসকাস করব। সো ফার্স্ট কোয়েশ্চেন হলো, morbid fear of open places or leaving the familiar setting home is known as. অপশন এ অ্যাগোরাফোবিয়া, অপশন বি অ্যালুরোফোবিয়া, অপশন সি জেনোফোবিয়া, অপশন ডি জুফোবিয়া। সো এখানে কারেক্ট আনসার হলো অপশন এ অ্যাগোরাফোবিয়া। Question number 72. The client has an order for 2 tablespoons of milk of magnesia. The nurse converting this to the metric system, how much she should have to give the client? Option A 2 ml, option B 5 ml, option C 15 ml and option D 30 ml. So 1 tablespoon সমান 15 ml. So here required medicine is 2 tablespoon. So 2 tablespoon is equal to 30 ml. Question number 73. Following sign and symptoms should be carefully assessed for diagnosis of preterm labor. Option A, at least 1 uterine contraction in 10 minutes lasting for 30 minutes and progressive dilatation of the cervix. Option B, at least 2 uterine contractions in 10 minutes lasting for 20 minutes and progressive dilatation of the cervix. Option C, at least 3 uterine contractions in 10 minutes lasting for 10 minutes without cervical dilatation. Option D, at least 4 uterine contractions in 10 minutes lasting for 30 minutes. So here the right answer is option A. Question number 74. Disease elimination is helped by. Option A, herd immunity, option B, isolation, option C, quarantine, option D, none of these. Disease elimination is helped by herd immunity. Option A is the right answer. Then question number 75. Frequent regurgitation in infants occurs due to. Option A, relaxed cardiac sphincter, option B, relaxed pyloric stenosis, option C, relaxed anal sphincter, option D, relaxation of glottis. So question number 75 এর correct answer হলো option A, relaxed cardiac sphincter. Question number 76. The ELISA test is used. Option A, screen blood donors for antibodies to human immunodeficiency virus, that is HIV. Option B, test blood to be used for transfusion for HIV antibodies. Option C, aid in diagnosis of patient with AIDS. Option D, all of this. ELISA এই সমস্ত টেস্টগুলি করার জন্যই দরকার পড়ে, সেই জন্য অপশন ডি ইজ দ্য রাইট আনসার। কোয়েশ্চেন নাম্বার 77. The progression steps in transmission of normal cells to malignant cells is concerned with following except. Option A, irreversible change occurred to DNA. Option B, altered appearance and biochemical activity. Option C, growth pattern of cells remain unaltered. Option D, tumors develop internal blood vessels. So cancerous malignant cell grow everything এখানে সমস্ত পয়েন্টগুলোই হয় এক্সেপ্ট সি। সিটা কি বলছে, গ্রোথ প্যাটার্ন অফ সেলস রিমেইন আনঅল্টার্ড। ম্যালিগন্যান্ট সেলের ক্ষেত্রে সেলের গ্রোথ প্যাটার্নটা কিন্তু ইনক্রিজিংলি হয়। সো হেয়ার দ্য রাইট আনসার ইজ সি। দেন কোয়েশ্চেন নাম্বার 78. What sign and symptoms do you expect in complete abortion? Option A, expulsion of fleshy mass per vagina with increased vaginal bleeding. Option B, expulsion of fleshy mass per vagina with decreased vaginal bleeding. Option C, expulsion of fleshy mass per vagina with decreased vaginal bleeding and decreased abdominal pain. Option D, expulsion of no fleshy mass per vagina with increased vaginal bleeding. Question number 78 এর correct answer হলো option C. Question number 79. Which element in the circular chain of infection can be eliminated by preserving skin integrity? Host, reservoir, mode of transmission and portal of entry. So এখানে correct answer হলো option D, portal of entry. Question number 80. Oral thrush is caused by A, gonococcus, B, E. coli, C, Candida albicans, D, staphylococcus. Oral thrush is caused by Candida albicans. Question number 81. Kaplik spot are characteristic feature of A, rubella, B, typhoid, C, rubiola, D, mumps. So এখানে কারেক্ট আনসার হবে রুবিওলা, যেটা হচ্ছে মিজলস। কাপলিক স্পট আর ক্যারেক্টারিস্টিক্স অফ মিজলস, দ্যাট ইজ রুবিওলা। Question number 82. Total fertility rate refers to a number of women between 15 to 44 years of age. Option B, number of birth per 1000 women. Option C, approximate completed family size. Option D, number of female children per woman. Option C is the right answer, approximate completed family size. Question number 83, bulging fontanelle is one of the most important sign of dehydration, increase intracranial pressure, increase intracellular pressure or fluid overload. So bulging fontanelle দেখা যায় increased intracranial pressure এর ক্ষেত্রে. So option B is the right answer. Question number 84, cord compression may occur in post-term delivery due to A, diminished Leica ramni, B, diminished Wharton's jelly, C, diminished placental function, D, diminished fetal urine. So here right answer is diminished Wharton's jelly. Question number 86. When patients are first informed that they have HIV positive, their emotional response include option A, anger at the person who may have given them the virus. Option B, guilt over their own role in exposing themselves to the virus. C, despair over the prognosis, sometimes triggering suicidal acts. Option D, all of these. Option C is the right answer. Question number 87, which of the following test is most sensitive for the detection of iron depletion in pregnancy? A, serum iron, B, serum ferritin, C, serum transferrin, D, serum iron binding capacity. So here serum ferritin is the right answer, option B. Question number 88, the mid-deltoid injection site is seldom used for IM injection because it can accommodate only 1 ml or less of medication, bruises too easily, can be used only when the patient is lying down, does not readily parenteral medication. So এখানে correct answer হবে option A, can accommodate only 1 ml or less of medication. Question number 89, which health personnel links between ANM and Wanganadi workers? Option A, lady health visitors. Option B, public health nurse. Option C, ASHA. Option D, social workers. So here the right answer is option C, ASHA. Question number 90, when teaching pregnant women about nutrition, the nurse would urge her to ingest foods containing which vitamin to prevent the risk of neural tube defects? Option A, folic acid. Option B, vitamin A. Option C, vitamin C. Option D, vitamin K. So folic acid neural tube defect prevent করে, so এখানে correct answer হবে A. Question number 91, Godel's sign is characterized by option A, bluish coloration of vagina. Option B, pulsation of vagina. Option C, softening of the cervix. Option D, firm cervix. So Godel's sign is characterized by option C, softening of cervix. Question number 92, mental disorder in which the thoughts, affective response, ability to recognize reality, communicate and relate to others are sufficiently impaired is known as option A, neurosis. Option B, psychosis. Option C, regression. Option D, repression. So option B is the right answer, psychosis. Question number 93, International Classification of Disease 10 is arranged as A, congenital malformation, B, neoplasm, C, certain infectious and parasitic diseases, D, external causes of morbidity and mortality. So question number 93 answer হলো option number D, external causes of morbidity and mortality. Question number 94, nursing care of a patient undergoing transesophageal echocardiography include option A, obtaining of signed informed consent. Option B, patient encouraged coughing. Option C, removal of dentures or oral prosthesis. Option D, all of these. So D is the right answer, all of these. Question number 95, unconscious defense mechanism is in which unacceptable behavior, motives or feelings are logically justified is known as option A, rationalization. Option B, reaction formation. Option C, regression. Option D, repression. So option A is the right answer, rationalization. Question number 96, sensitivity of uterine musculature during labor is occurred due to option A increased progesterone level, option B increased estrogen level, option C decreased estrogen level, option D increased estrogen and decreased progesterone level. So sensitivity of uterine musculature during labor is occurred due to increased estrogen and decreased progesterone level. Option D is the right answer. Question number 97. Ram is admitted in psychiatric unit with the diagnosis of bipolar disorder, single manic episode. Which of the following behaviors would the nurse expect to assess? Option A apathy, poor insight and poverty of ideas. Option B anxiety, somatic complaints and insomnia. Option C elation, hyperactivity and impaired judgment. Option D social isolation, delusion of think and clang associations. So 97 এর आंसर হলো অপশন ডি ইলেশন hyperactivity and impaired judgment. Question number 98. Nurse is aware that language development in autistic child resembles A scanning speech, B speech lag, C stuttering, D echolalia. So here the right answer is D echolalia. Question number 99. Total number of primary tooth is option A 20, option B 30, option C 24, option D 20 to 30. So এখানে right answer হলো 20, option A. Question number 100. The basic cause of distributive shock is option A an antigen antibody reaction, option B dilatation of blood vessels, option C failure of the heart as a pump, option D blood or fluid loss. Option B is the right answer, dilatation of the blood vessels. থ্যাংক ইউ বন্ধুরা, আজকে এই পর্যন্তই। নেক্সট ভিডিও 2023 নিয়ে বানাতে চলেছি।